The nationwide positivity rate in the Philippines has jumped to 9.6%, while new COVID infections have gone up to 2,000 per day. That is the highest in almost 5 months. To help us make sense of these numbers, we have infectious diseases expert Dr. Rontgene Solante joining us over the phone. Good afternoon and welcome back again, Dr. Solante. Is this the start of a new surge or is this already a weak surge? And how concerned should we be at this point?
Hi, Sean. Good afternoon. Yeah, so I think we now have the uptake of the cases is brought about by the subvariant, the more transmissible subvariant. And we expect that cases will be higher in the next few days or even 2 to 3 weeks from this week.
All right. So while the DOH and you also, of course, concur with the increasing presence of these Omicron subvariants, what should the government do? Should they enforce stricter border controls? Should the alert level be increased? How can we effectively address this threat?
With the ongoing, possibly community transmission already of the subvariant, then I think it's useless doing a border control. What's important now is to enhance our booster vaccination because that's the important part here, building population immunity. Even with the threat of increased cases, then we will be protecting our people not to develop severe cases and thus decrease number of hospitalized, number of cases.
All right. Since we are already talking about increasing booster shots, Dr. Solante, what should the government do to ramp up inoculations? You know, a few weeks ago, you've been reporting that there is kind of a slower uptake in booster vaccinations recently. Should they, encourage more people across all, classifications, sectors, and age groups to get their boosters?
I think this is the time, Sean, that the government should consider mandatory vaccination. In other countries like Singapore, Malaysia, Thailand, and Vietnam, they have higher boosted population than us, more than 50%, while our boosted population is still less than 20%. And that's, I think, for us to really put up the wall of immunity, less severe cases, we need more people to be boosted, and if there's a need to really make it mandatory, then I will fully support for that.
All right, just to clarify, Dr. Solante, by making it mandatory, do you mean changing the definition of fully vaccinated to include the 2 primary doses and the booster shot, so a total of 3 vaccinations, to be considered as fully vaccinated, for example, to go to public places, to enter malls, to eat out in restaurants, and so on?
Yes, it's important that we need to increase our boosted population. Even if you receive the primary vaccine series, it may not be enough to protect us against these new variants that are highly transmissible. So we need to have that booster in order for us to move on. And if there is a plan to relax, especially the mask mandate, one of the important metrics there is 70% vaccination boosted will be a good target.
All right, let's move over now to hospitalizations. Hospital groups are saying that they can still manage cases or admissions despite the uptick in cases. Are you in agreement with this? Do you see the same thing on the ground?
Well, our hospital system, in terms of occupancy for COVID cases, are still not overwhelmed. I say we are stable. So we have a very good low hospital utilization rate even with the increasing number of cases.
All right, going back to what you said about having to hit about 70% of the population with booster shots before we can even think about relaxing mask mandates. Recently President Bongbong Marcos mentioned in a speech that we could soon do away with alert levels and, of course, relaxing the mask mandate. Are there any signals that we are ready for that here in the Philippines?
Well, as long as people are not in the hospital, meaning the hospital utilization rate is low, and despite the increase in the cases, I think there's already an element that we are into endemicity of this particular infection. But again, we should not be complacent. The health protocol should stay. Mask indoors should still be very important. And we still encourage people to be very careful, especially with interaction and crowd and gatherings. And again, more importantly, we need to increase our boosted population.
All right, so just to clarify what you just said, Dr. Solante, we are in track in terms of transitioning into a COVID endemic stage?
Yes, yes.
All right, thank you so much for your time. As usual, infectious diseases expert Dr. Rontgene Solante joining us over the phone. Thank you, Doc.